So when you come into our access center at Ridgeview, you would check in at the receptionist desk. Okay, you would just give them the name, and they will hand you some information to fill out. Mainly, this is demographic information. Then one of our mental health techs will come meet you in the lobby, greet you, answer any questions that you initially have, talk to you a little bit about what our process is that I'm going to explain to you in just a moment. They'll get copies of insurance cards or IDs if you have them, and they will gather that information that the receptionist gave you. Okay, this kicks off an alert to our clinicians of there is somebody in need of an assessment. Okay, so at that point in time, the mental health tech will be updating you about the length of time of the potential wait, but the mental health clinician is the next person that's going to be meeting with you. That person is either associate licensed or a licensed therapist. They're going to be asking you a lot of different questions. We do a self-report assessment. Based off of the needs that you present with, we are going to be giving you a level of care recommendation that's actually given by one of the psychiatrists here at Ridgeview. So the mental health clinician's job is just to really understand all the ins and outs of what the presenting concerns are, what you are needing treatment for, what your goals for treatment are going to be, to really help our treatment team, once you're in the program, set up a really great treatment plan for you to get you back in a place where you're really functional, operating the best you can. So that assessment piece is very, very important. So that process, sitting down with one of those clinicians, takes about anywhere between 40 minutes to an hour, sometimes more, just depending on the individual. Okay. So after you're done speaking with that person, that's when that clinician will go speak with one of our psychiatrists and do a staffing with him or her, and then they will come back and report to you about what the recommendation is. We always love for family to be involved in the assessment process. So sometimes we will meet with the family if they're present individually without you. We'll leave it up to the patient, whatever you would want. Would you want the family in the room with you? Do you want them to wait in the lobby, or do you want us to meet with them separately? We always want to have that option because family a lot of times can have an awareness that maybe patients don't. But we do believe involving the family in the treatment, and it starts at the initial point of service in the Access Center. We also want to communicate with outside providers as well. So if you have an outside therapist, outside psychiatrist, with a release of information that we give you, a form to fill out in the Access Center, when we have that signature and the identified person, we'll reach out to them as well, because that's going to be important for your continued progress even after you leave Ridgeview. So the recommendations given, if you're given an inpatient level of care, then we can go ahead and start that admission immediately. Okay, so at that point, our mental health tech or clinician, really just a team member in the Access Center, is going to meet with you, go over all the voluntary consent paperwork, answer any questions you have, get all the signatures needed, and then we would then introduce you to one of our financial counselors. We do believe that it's important for you to know what the expenses may be while you're here, so there's no surprises 3 days in. So that person will also meet with you upon the initial admission process. After all those steps are completed, then you would go down to one of the cottages and do an orientation with one of the nurses in the program and one of the mental health techs. Now, if it is an adolescent, at this point, legal guardians will go down to cottage A or B, depending on which one you're assigned to, and they'll go down and do the orientation with it. If it's an adult, that would be at the point where you depart from your family members, and the patient would go down to do orientation by themselves.